I have, I don't know if the right terminology even still now, a daughter.
Alcohol, pot, just sort of whatever was available became like cocaine, and started using it intravenously. Within a year, I was like bottom.
Our program started in 2014. Because of the opioid overdose crisis, we knew that people were dying. Harm reduction is about meeting people where they're at and not requiring the cessation of use, but keeping people as safe as possible in their use.
Trying to get off drugs, you need a great support system, and to leave your past behind and the friends behind and that whole thing behind, and to deal with your baggage.
It could be any one of us. We all probably have people in our lives that have issues with addiction.
People see this very sick person on the side of the road, and they think that's a drug addict. That's a drug addict at the bottom, and with no help up. That person was an addict somewhere else before they were on the side of the street.
There's so many addicts that are lawyers and doctors and in the homes next door that people aren't aware of, that are also going to the methadone clinics and getting prescriptions and that are needing help. And the problem is that they've been stigmatized for so long.
Some of the rehabilitation centers in Ontario, you're treated like an inmate. You have to cook, you have to clean your toilets, you have to do all these things. If you had cancer, you would never have to go to the hospital and clean a toilet. There's no dignity right now. I think lining up at a methadone clinic in downtown Woodstock or downtown wherever, there's no dignity. There's so much shame involved with that.
By golly, I loved my daughter. I knew she was still in there. I mean, her heart was in there. Her soul was in there. Her eyes were dead, but I knew that somewhere in there she was there.
I certainly was pretty ashamed that I was this husband that was, overheating in the bathtub. She'd come home and I was literally, in ice cubes trying to cool myself down from, being on the brink of an overdose. She could never get the picture of me in the bathtub out of her head, which still kind of hurts. My actions gave her trauma.
Because I understand addiction is based on pain.
They need an outlet or need a program like ours. So we need supportive housing where there's addiction supports and where people might not have to quit just yet.
I believe, harm reduction can help, and I think, methadone can help. But I don't believe that is ever the end. That we need those to be given with excellent mental health care, excellent addiction care, and to be treated like humans.
If you can get off drugs and stay off drugs, that's great, because it's tough.
And I don't believe any addict wants to be that person. I didn't want to be that person, so I did the things that they told me I needed to do to not get back there.
Harm reduction is part of a continuum between prevention, treatment, and enforcement, and again, that community belongingness.
Everyone's worth it. We're all worth it. Knowing you're worth getting better, thinking about what did you want to do with your life? What did I want to do with my life? Well, I'm worth it. I'm worth trying to be that person.